Once again, a lot of people think that I'm going to do everything at the same speed and the same depth. That is not the case, because I'm going to see how your skin responds to the procedure. So we're just going to start off over here. How are you feeling? Do you feel what's going? I mean, you can feel me doing something, but
yeah. First, let's define a hormone, because so often we use these terms and yet we don't fully understand their role. A hormone is really just a chemical messenger. Hormones are created in one part of the body, usually our endocrine glands, and released into the bloodstream to travel to another part of our body to tell it what to do or not to do. Hormones shape who we are and how our body was created. So in essence, our hormones made us who we are, for better or worse. So it's safe to say that they are pretty important. For the sake of this series, I am only going to address the hormones that we know can affect our mood, are involved in birth control, and those responsible for puberty. Those hormones are progesterone, estrogen, and testosterone. They are what we call gonadal hormones, and they occur in response to hormones released by our pituitary or endocrine glands and other parts of our brain. They are the ones responsible for shifts in our mood and are obviously connected to puberty and our reproductive organs. Therefore, in my case, changes to my birth control made me feel irritable and just not myself. Progesterone's role is to prepare the uterus for pregnancy and stop it from contracting, which could cause someone to lose the egg. It also prepares our body for milk production. When our body produces high levels of progesterone, it does not ovulate, which would explain why it's used in birth control, because no ovulation, no egg, no baby. When it comes to our mood, progesterone has been shown to activate our amygdala, which you know what that is, pulling us into fight, flight, freeze, and preventing us from being able to think clearly or use our wise mind. It pulls us into our emotion mind, where we can act in a less rational and more easily upset way. This could explain why when I changed over to a progesterone-only birth control, I was agitated and more stressed out. Progesterone in moderate amounts, not high levels like when we're pregnant, can also trigger depressive symptoms, which could explain why so many new mothers experience postpartum depression as their progesterone levels lower into a more moderate range. Next up is estrogen. And according to Johns Hopkins University, estrogens are a group of hormones that play an important role in the normal sexual and reproductive development in women. They are also sex hormones. The woman's ovaries make most estrogen hormones, although the adrenal glands and fat cells also make small amounts of the hormone. In addition to regulating the menstrual cycle, estrogen affects the reproductive tract, the urinary tract, the heart and blood vessels, bones, breasts, skin, hair, mucous membranes, pelvic muscles, and the brain. Secondary sexual characteristics such as pubic and armpit hair also start to grow when estrogen levels rise. When it comes to how it can affect our mood, it can actually improve our mood because it increases serotonin levels in our brain. Estrogen is at its highest in the first 2 weeks of our cycle, and that's why right after our period, we can feel a bit better, and our depressive or PMS or even PMDD symptoms can go away for a little bit, or at least lessen. And finally, there is testosterone. Now, we usually think of testosterone in men and how it applies to their sex drive and stamina. But women also produce testosterone. It's just a lower amount. It's produced in the testes, ovaries, and in the adrenal glands. In men, it does affect their sex drive. It deepens their voice, affects bone density, produces sperm, and initiates the growth of body hair. And it can increase their muscle mass. In women, it also initiates the growth of body hair during puberty, but it helps improve our bone density and increases our sex drive. However, if testosterone gets too high, it can also cause us to have more acne, hair loss on our head, but increase hair growth on our body, cause us to gain weight, and even cause PCOS or polycystic ovarian syndrome, just to name a few things. When it comes to our mood, if men have lower levels of testosterone, it can lead to symptoms of depression, irritability, and lack of motivation. But if men have a higher level, they can experience mood swings, have impaired judgment, and even struggle with delusions. In women, it's in the higher levels that our mood can change and we can become irritable, easily agitated, and even aggressive at times. As you can see, it's a tricky balance our body keeps so that we can develop and grow while also keeping our mood stable. And that's why it's so important that we ask our doctors about any medication we may be taking or considering taking to find out about the side effects and what we need to look out for. And if you want to learn more about hormones, I will link all the articles that I read and did my research about to make this video in the description down below. You mentioned briefly about like if you're on contraceptives or birth control in particular can change kind of that quote unquote month cycle we're talking about. So I'm curious like what hormones are affected by birth control and what are those hormones responsible for? I mean, I could make guesses, but I'd rather hear it from the expert.
Yeah, so in general, like when we talk about birth control, like a hormonal contraceptive pill that contains estrogen and progesterone, or even one that just has progesterone, we think about those as basically serving a purpose of stopping ovulation. So instead of having these hormone fluctuations where you have the high follicle stimulating hormone in the beginning part of your cycle that gets the ovary ready to ovulate, that kind of stays at a steady state and doesn't peak and go up to cause a follicle to get ready to ovulate. And then you don't have the LH, which is what causes ovulation. So instead of, it doesn't really, people sometimes say it mimics pregnancy or things like this. And I wouldn't quite go as far as to say it mimics pregnancy, although your hormone levels are slightly higher than they would be at certain points in your cycle. It basically just prevents ovulation and keeps everything kind of at a steady state, which is why a lot of people feel that their hormonal mood changes tend to be a little bit better on birth control pills.
Is there a way to get our hormone cycles checked? I know that sounds kind of strange, but I was just curious, like, how do we know how we're doing or where we're at in things? And I know you can check your ovulation, like so many of my friends that trying to get pregnant have those sticks they pee on to tell if they're ovulating or not. But is there a way to check our hormone cycles?
Yeah, viewers of my channel will know that I have a big problem with all the places that advertise like get your hormones checked or your hormones are out of balance or get this panel done, because I strongly believe that panel medicine where you just check a whole bunch of levels is bad medicine. And it gives people kind of a false sense of security. So what I tell my patients is, yes, there are ways we can look at your hormone levels, but if you are having regular cycles and nothing else is going on that's out of the ordinary, then checking a bunch of labs isn't going to help me with anything. But if you have a specific problem that you're not having periods, your periods are irregular, there's things going on, then there are specific hormones that I would want to look at a specific time in your cycle, because your hormones change not only from day to day or from point to point in your cycle, but by the time of day. And so I could look at your hormone levels right now and they would be totally different in a week. So it's really, really important to know exactly what the problem is and then look at the hormones related to that problem at a very specific point in your cycle.
Now that we've learned all about hormones, and I'm going to be honest, I didn't realize A, how many hormones we had, or B, how many needed to stay in balance for me to feel okay. So that was really informational and educational, and just reminds me again why we need to talk to professionals about things and get real answers. Because we've learned, if you don't remember last episode, we learned that it's most likely my birth control did not cause my melasma, that it might have a different cause. So let's get back into Dr. Hirsch's office and talk to his esthetician, Jo, because she's the one that's going to help us, and we're going to start the treatment plan to hopefully make this go away.
I'm Jo Halliday, and I work here at Hirsch Plastic Surgery. I'm the esthetician, and if you have skin problems, you come to me because I've been doing this quite a while. Microneedling, which is very, very popular right now, is such a great procedure for every skin issue because it tightens your skin, it brightens your skin sheds a little bit, you get a wound response, so your body will repair the wounds and make your skin even healthier. So it's great if you've spent years and years in the beautiful Southern California sun. You can get that kind of sun damage, crepey look and the hyperpigmentation and the keratosis.
Today we're doing microneedling? And how does that work? What's it like?
So a lot of people get scared of microneedling because it is a device with 12 needles and I am going to puncture your skin. It's going to create a wound response, and that wound response is going to build new collagen, elastin, and high hyaluronic acid. However, you don't have to be scared because we are going to numb you first. The reason it's so good is it's going to do a couple of different things. First of all, I'm going to ablate your epidermis.
Okay.
What does that mean? I'm going to break it up, right?
Okay.
I'm going to break it up. Now, because it's your epidermis and it's attached to your dermis, it's not just going to break up and fly away into the air. It's going to take about a week to kind of break away. Not quite as much as a chemical peel will. It's going to be more of a shedding. Why is that going to help you? Because if the top of your epidermis, your stratum corneum, is shedding off, it's going to take some of the discoloration away. It's just going to make your skin look much nicer in general because everything that's on the surface of your epidermis is going to shed off. Now, secondly, I'm going to puncture your skin all the way down to the dermis.
Okay.
Now, the nickname for the dermis is true skin. The reason for that is everything that happens in your skin truly happens in the dermis.
It comes from the dermis.
Yeah, everything's happening in the dermis.
Oh, interesting.
Your epidermis is essentially, they like to call it a dead layer. It's not really dead because it really does a lot of things. But it's there just to protect you. And think of it like an overcoat. It's like kind of like a raincoat. It just keeps everything out and in.
Gotcha.
And that's what your epidermis does. But your dermis really does all the repair work. So we're going to puncture your dermis. I'm going to be using high hyaluronic acid and human stem cells as I'm doing the procedure. So on one hand, I'm laying in this amazing product and serums that will get right into your dermis and help do some of the repair work because of your melasma and your discoloration. And then secondly, you are going to get that wound response. So your body is going to realize, oh gosh, something's really happening. She's wounded. Let's get up there and repair it, which is awesome because it doesn't do that at any other time. Not to your skin.
Interesting. So it's like we're forcing it to regenerate.
We are. Your brain kind of says, oh, you know, the skin's doing its job. It's fine. It really is.
Because it's protecting us, right? That's its goal.
Let's take care of the kidneys, the lungs, the heart, the brain. Let's take care of all those other organs and we'll leave the skin alone because your brain isn't vain.
Yeah.
We're vain.
We're vain.
So we're going to trick your brain, we're going to wound it, and it's going to flush it with your own stem cells and repair everything. Because you will have some dry skin. This is another thing. People get a little bit worried about the week after this procedure, their skin feels dry, but that's because, remember I told you I'm going to ablate your epidermis. It's going to break it up. So your skin will seem dry. Don't worry about that. Once it all sheds off, then you're going to look amazing.
Okay.
Every now and then I'll get a snorer. And I always get the same thing. Somebody sees it on the internet, they come in, they're terrified. I keep telling them, don't be terrified, it's going to be fine, I'm going to numb you. And as soon as I start the procedure, they go, oh, that's it? I thought it was going to be so much worse than that.
I think just the name makes you think it's going to be bad or scary, you know?
Is that microneedling or collagen induction therapy?
Yeah, needling. I think the word needling. If people are nervous about needles.
Yeah. Have you ever had any acid on your face? Any chemical peels?
No.
Okay. I'm going to wipe over just a very, very light acid today. And like I said, that's just going to clean up everything on the top of your epidermis. Once again, when I'm doing chemical peels on patients that have melasma, they come in and they've seen all this stuff on the internet and they say to me, just peel my whole face off. They literally put the strongest thing you have back there, peel my whole face off. I say, well, you know, that's not going to work for you because the stronger the peel, the more heat it's going to create.
Which is more inflammation in your skin, right?
So that's not going to really help you. We have to, sometimes we have to tiptoe. We have to do a progressive system where we try to, once again, trick your skin or your melanocytes into thinking that we're not heating them up. Like I said, this is a very light acid. It's actually mandelic. Mandelic is a bigger molecule, so it penetrates the skin a lot slower. How long have you had the melasma?
Probably 2 years.
Because the heat is created internally, people just assume that they just need to put a whole bunch of stuff on their skin and that's going to fix it. But it's not. You've got to work inside and outside, extrinsic and intrinsic, to really get results. So, and that includes ridiculous things like stop eating spicy food.
Yeah, it makes sense because heat. It generates heat.
But people don't think of it like that. If I tell them, oh, you know, you should stop doing these certain things in your diet, or drinking too much coffee or alcohol or spicy foods, why do I have to do that? Because you're creating so much inflammation, internal inflammation, that it doesn't matter how much product you put on the surface of your epidermis, it's not going to do the full effect. Did you feel that the tingle subsided yet?
Yes.
Okay, perfect. All right, so now that we've cleaned you up, I'm just going to wipe a little bit of alcohol over your skin, and then we're going to put the numbing cream on.
Okay.
And I apologize for the smell. I know that alcohol doesn't smell delightful.
It's okay.
This is the numbing cream.
Okay.
So just in time for the holidays, you're going to look like a tomato.
Perfect.
Actually, you won't. Your skin will look amazing by the time the holidays. I mean, they're here already, but
yeah,
you
but
know
like
what
a
I'm
week.
saying.
Yeah.
A week from now, your skin's going to look great. So that is the numbing cream, and we're going to leave this for about 15 minutes. You can take a nap.
I know.
Till I come back.
Perfect. Thank you so much, Jen.
My pleasure.
I'm excited. I'm kind of nervous, but it's interesting to learn about the skin because I've always just like watched on Instagram. I feel so hypocritical because I'm always telling you guys to like see a professional, talk to a real doctor. And then here I am like buying items on Sephora without actually consulting a physician. So that's what we're doing. And this is very cool. And I already feel kind of numb. I'm just kidding.
Let's suit back up here. And so I am going to put a little bit of hyaluronic acid on your skin, and that's going to help the needles glide across your skin. You actually can do dry needling.
Okay.
And just find that it's, you know,
Like pulls more or
kind of
something.
drags across the skin. So we like to put a little bit of glide on the skin.
Okay.
It's a lot more irritating, not uncomfortable on the forehead, even though you're numb.
Just because there's
Forehead
not
is
much
skin
there.
and bone.
Yeah, that's the thing.
So even if you're numb all over your face, you still kind of feel it a little bit on your forehead.
Okay.
So I'm going to start off on your cheek.
Okay.
And then hopefully I'm going to tire your synapses. And by the time I get to the forehead, that'll help a little bit.
It's almost like when I have a tattoo. I have two tattoos. It's like at first you're like, ooh, and then you kind of burn out from it.
Yeah, you
You're
get
like,
synapse fatigue. Some people don't realize this, but all the probes should be, generally are, one-time use disposable.
Okay.
I'm not aware of any probe, which is the group of needles that you put on the end of the device. I'm not aware of any probe that is multiple use that you autoclave. They're all disposable.
Probably just for cleanliness.
Yeah, I mean, you have to. I'm going to break your skin right now. So everything has to be sterile. So I cut it open with scissors. I'm going to use it on you. And then everything gets put in biohazard afterwards.
Okay.
So it's as safe as it can be.
Okay.
The device has different speeds and it has different depths. Once again, a lot of people think that I'm going to do everything at the same speed and the same depth. That is not the case, because I'm going to see how your skin responds to the procedure. So we're just going to start off over here. How are you feeling? Do you feel what's going? I mean, you can feel me doing something, but
Yeah, but no pain.
But no pain. All right. So it doesn't really look like a lot's happening right now, but you might be able to see that there's a tiny little bit of erythema building up there, redness, and what that is all those little needles are puncturing her skin and causing that inflammation. And as of now, there isn't any blood You know, the blood doesn't come right away. That comes after I've gone over the skin dozens and dozens of times, and especially if I start making the needle depth deeper and deeper. Now with your skin today, that's really not going to be what I'm looking to do because you have melasma. So I'm trying to break open your skin here, cause that wound response. I'm going to put some human stem cells on here in a minute so we can get it into the dermis. But I don't want to cause too much trauma to the skin. This does have a nice lifting effect to the skin as well. So that's why it's a great anti-aging treatment. Especially when I come around this jowl area, I do find that most women complain that, you know, after 35 or 40 years old, that they start to notice a little bit of sagging in the jowl area. So I tend to work this jowl area even extra to give it a nice little lift. It does take multiple treatments, but some people see it even after one treatment. They notice that their skin looks tighter. So not only are we trying to help your melasma here, we're also going to make you younger. That's great, right? Just don't take out your birth certificate. And then we'll know the truth. The redness is really starting to build up a lot now, and inflammation grows at different rates with people. So some people will get slightly red and other people will get really, really red. But what I tell everybody is that once you leave here, your skin will get redder. The inflammation will continue to build, and so by tonight you may be very, very red and feel like you've got a sunburn. And be quite uncomfortable, to be honest. That's why I say don't work out. Your face will be on fire. Okay, so let's turn your face a little bit this way. Great. You told me earlier that Dr. Hirsch was going to prescribe some skin serums for you to use for the melasma. Now, anything that he would prescribe for you for that would be something that you will not use after this procedure. So for a week after this procedure, you wouldn't use anything too stimulating. So no HQ, hydroquinone, no retinol, no acids whatsoever. Don't scrub your face. You've really got to spend the next week just letting your skin heal and calm down so that inflammation goes away.
Okay.
We don't want to keep it holding on. We do want it to resolve itself.
Yeah, to heal what we've done. Yeah.
So then we usually give it a month, 4 weeks, and then you can do the procedure again. Sometimes during the treatment, just because your skin is getting super hot, even that numbing won't stop you from starting to feel the burn. Okay, and now we're going to do the dreaded forehead.
Okay.
I'm going to turn the speed down a little bit for your forehead because it is usually super sensitive.
Okay.
Are you okay? All right.
It is worse, but it's not bad. You know what I mean? It's just
You're
like
a trooper.
you feel it more.
For sure. But you've had tattoos, so you should just be fine with this. Does it feel the same to you as your tattoo that you had?
Kind of, because the vibration and the little sting.
Yeah.
But yeah, just different, guys, because it's your face, you know. But
well, it's also because there's this should actually not be as bad as a tattoo because it's 12 needles in here, whereby when you do the tattoo, depending on whether you're shading or doing the lines, you might use 1 needle, 3 needles, or 9 needles. The more needles, the less it hurts. When you use a 1 needle, it really hurts.
Oh, interesting.
Because I do the tattooing as well on the cancer patients.
Oh, yeah.
So for the areolas and the nipples, when they've lost them after the surgery, then I do the 3D. And that one needle can cut like a knife. So I don't think this is really as uncomfortable as getting a tattoo. Nose is just like the forehead, it's just all skin and cartilage, so it's usually a little bit uncomfortable.
I'm okay.
At least you haven't sneezed. Everybody usually sneezes when I do the nose and the glabella here.
I could feel it.
They get the sneezes, yeah. The upper lip is usually very sensitive too. The reason for that, it's called double intensity because the nerves wrap around your face and they actually double over on top of your lip. So you have, the nerves are doubled over. So whenever I get to this area, people find it very, very uncomfortable. So I usually don't use a terribly deep needle in that area either. This is where you can use the really deep. And this is where most people get their acne scars. So when it comes to treating acne scars, I can really go deep with the needle and be more aggressive because it's a meatier area. All right. Looking good. Oh, we have a guest.
Hi, Dr. Herman. It's great. We're finished, I think. With
Yeah,
it wasn't that bad, really.
Let's take a look.
No. It's nice and glowy.
It wasn't too uncomfortable at all.
All right. Yeah, Joe's very skilled with the microneedling and just kind of keeping you comfortable. But at the same time, your depth, I can tell from what she did, you're going to have some good improvement here.
Good.
Just the overall depth that she went at, a little bit of redness you're having now.
And she was saying no nothing for a week until.
Except for stem cells and hyaluronic acid.
Soothing stuff.
Okay. Yeah, like the cooling, the soothing.
Yes, like we talked about.
Got to keep the inflammation down. I'm trying to absorb all the information.
Well, she's going to get written instructions.
Yeah, perfect.
Because I talk a lot.
But great information. Really helpful.
Absolutely.
There you go.
Very good.
Awesome.
Wonderful.
We are in contact with the compounding pharmacy. We ordered you some stuff.
Okay.
And that should be coming sometime soon. When you come back for your next treatment with Joe.
Okay.
That's when we'll go over the next step for you.
Okay, wonderful.
Good.
Perfect. Yeah. Thank you so much.
My pleasure.
I'm excited to see how this is, like what it...
You look good. I just put some tinted sunblock. So zinc or titanium.
That's what,
Yeah, no
Dr.
chemicals,
Hirsch said that.
just zinc or titanium.
The physical sunscreen, right?
Physical, yeah.
See, I'm remembering some things.
It actually should be sunblock, not sunscreen. Filters it through.
Makes sense, just
so
the terminology.
You get some sun, and sunblock blocks it. Hence the name sunblock. That's zinc or titanium, just blocks it.
Gotcha.
And that's what you need right now after this procedure is block.
I'm just going to go home and watch some crime on TV.
Super important that you use a very, very gentle cleanser. You don't want anything with any perfumes.
Gentle with my hands too, I presume.
Yeah, well, for the first couple of days. After that, wash how you want. But it's just important that what you get in your skin, you don't want to get any perfumes or fragrances. So the Aura RX Gentle Cleanser, it's perfect for after any procedure because it's as clean as it could be, the cleanser. Also, we've given you a couple of serums. One is the HA Calming Balm, and the other one is the HA Soothing Serum. One of them has a little bit of arnica in there too. They both have high hyaluronic acid. So when you're feeling the burn, put on the soothing serum.
We don't want to feel the burn. This isn't an aerobics class.
No, you don't want to feel the burn. Put on the soothing serum. And then as far as the calming balm, just put it on all the time, actually, even after the procedure.
Okay.
Every day for weeks and months for the rest of your life, put it on because it's high hyaluronic acid and it's all good ingredients in there. It's just going to keep your skin nice and hydrated and plump. So you're going to love the products. If anybody, if you want to find out more about the products, you can always go to aurarx.com.
Okay.
And it is available on Amazon too.
Oh, wonderful.
Yeah, so
okay, cool.
that's always handy. We love
delivered in 2
I know,
days.
we love our Amazon ways.
Okay, so this is just like a few hours. What time is it? It's 7 p.m. So I had this done at 4. I'm definitely much more red than last time. Even my little chickenpox scar here, she really went over to try to get it to, fight the scarring. My face is a little bit on fire.